we essentially used IQVIA's claims database to identify eligible patients. And we categorize these patients through three different cohorts, right? So the first one being patients who are in the accumulator cohort, second one being patients who are on maximizer cohort, and then the third one, patients who are on standard copay or coinsurance designs. And then essentially what we did is we looked at these claims based on three therapeutic areas. So we looked at oncology, immunology, and then neurology or subset of that, multiple sclerosis. So for copay adjustment programs, those three therapeutic areas are some of the top therapeutic areas that have these copay adjustment programs implemented within them. So in these therapeutic areas, these patients oftentimes get copay assistance for these branded medications. Our main finding showing that for patients who are on copay accumulator programs, these patients are experiencing out-of-pocket costs 4 to 10 times higher than patients who are on these standard copay programs, and really just goes to show that if patients are unable to afford these medications, that of course leads to downstream issues in patient access to these medications, less adherence to these medications, and ultimately worse patient outcomes for a particular disease that they have. Patients who are part of these programs experience these copay surprises. When their manufacturer copay assistance funds are exhausted, they get hit with these very high out-of-pocket costs that ultimately led to that higher out-of-pocket cost number that we found in our study. Medication persistence as defined in our study. So this is like a proxy for medication adherence. But essentially it means when a patient initiates a drug, how are they on that drug 13 months after they initiated it? And we define that as medication persistence. And really what we found here, no surprise with the copay accumulator group, these patients had lower proportions of medication persistence compared to the standard copay group. So it's 54% persistence for the accumulator patients versus 62% for the standard copay group.